I'm Dr. Rohini, one of the consultant in reproductive medicine working in Vardhan Fertility Centre. So today I will be talking about one of the most common problem that is faced by women in India, that is PCOS, Polycystic Ovarian Syndrome. So in this condition, basically, women with PCOS have slightly larger ovaries compared to other women, and which causes lot of hormonal problems in them. So the common complaints that women come to our clinic with PCOS is usually they have delayed periods or irregular periods or no periods at all, and these women too experience lot of weight gain, quick weight gain, or they find it difficult to lose weight despite having a active lifestyle, and then they might have loss of hair, oily skin, acne, and difficulty in getting pregnant. So, what is the cause of this condition? So, till now we haven't identified any specific cause, but we know that it's runs in families. There is a genetic linkage to it. So, in case if there is a woman whose mother or sister have had PCOS, then there is a high possibility that she might also have this condition. So, but there are certain hormonal imbalances which is responsible for all the complaints that these women have. Mainly there are two hormones which are the culprits, that is testosterone and insulin. So, testosterone, as general public, everyone knows that it's a hormone which is mainly present in males. But this hormone is also present in very small amounts in women, which is produced by ovary. But in women with PCOS, this hormone is produced in excessive amount, and which is responsible for the facial hair growth and loss of hair and acne in women. And the second hormone is insulin. Insulin is an hormone which is responsible for controlling the level of glucose in our body, which is a type of sugar. But in women with PCOS, the insulin is not able to regulate this control. So there is more and more production of insulin to control the sugar levels. And this high levels of insulin is responsible for the weight gain, irregular periods, and difficulty in conception. Now, it's very difficult to identify which women have PCOS and who do not, because most of the women have frequent weight loss, weight gain, and hormonal imbalances on and off. So, it's difficult to identify. As you know already, that whenever women go for general health checkup, they have to go for an ultrasound, and very commonly you would have come across an ultrasound report where it would have been mentioned PCOS. So, does having just an ultrasound report with PCOS diagnosis, does that diagnose women into PCOS category? No, it does not. There are certain other criteria. So, first of all, yes, one of the criteria is having a ultrasound report which shows PCOS, and the second thing is a woman coming with irregular periods or no periods at all, and the third sign is if they have excessive facial hair, acne. So these three conditions, out of this, even if two conditions are present, then we would diagnose the woman to have PCOS. So now, why we are worried so much about this condition? First of all, yes, it does affect your fertility. It does reduce the chances of woman becoming pregnant on her own. And there are other long-term effects also on the woman's body that we are very concerned about. One is that these women, because of the derangement or the abnormality in their insulin levels, there is a chance of them developing diabetes in the long term, hypertension in the long term, and also since they bleed very less often, like once they bleed once in 3 months or 4 months, this also causes a thickening of the lining of the uterus. So this also increases their risk of developing cancer of the uterus in the long term. So it's very important that we treat this condition not with the perspective of only treating the fertility and all, but also thinking about the long term effect of it on the woman and taking care of her body. So now I have spoken about how to identify women with PCOS. Next would be how to treat them. So the initial treatment would be just doing some basic changes in your lifestyle, like eating, having a healthy diet. So diet wise, you should have regular meals. Try not to skip your breakfast, and the meal should consist of fruits, vegetables, cereals like chapati, brown rice, and try to avoid processed sugars, junk food, oily food, and coffee. And then try to cultivate a more active lifestyle, like exercise for at least 30 minutes thrice a week, and then try to reduce weight. We have seen that these simple measures and weight reduction can on its own treat PCOS. But just in case, if we find that the woman is not responding at all to these simple changes, then we would start some medical therapy for her. That would be some hormonal therapy. We would be starting her on contraceptive pills for a period of around 2 to 3 months, which would bring down her hormone levels. And then there's also this medication metformin, which would also reduce her insulin levels, and that will again bring back the hormones to a balance. So now I have given you a basic overview about PCOS. In our next session, we would be talking about PCOS and how it affects your chances of becoming pregnant, and how would we treat you when you come to our clinic. Thank you.